In some pockets of the country, large numbers of healthcare workers have turned down the vaccine, raising concerns about the rollout. But here in San Diego, it's a different story. ABC 10 News anchor Derek Stahl is going in depth on the number of workers who turned down the shot and the complicated reasons why.
Long line here to try to get into the fire authority to get vaccinated.
Despite the massive demand for the COVID-19 vaccine, in some parts of the Southland, a surprising number of high-priority healthcare workers have said no thanks. About 30% of the healthcare staff in Orange County have turned it down. Around 50% said no in Riverside County.
Hesitancy as a whole is a lot of different things. It's not just one thing. It's definitely not just an anti-vax community kind of thing.
Dr. Christian Ramers of Family Health Centers of San Diego says there's a wide range of reasons shaping workers' decisions at his clinic.
I think we had almost no declinations from the frontline healthcare workers that are seeing patients and that are at the highest risk. When we get a little bit more into the back office and people that are working from home and that kind of stuff, there was a little bit higher declination rates. Beyond that, it's almost like everybody has their own reason.
Dr. Ramers says some of the refusals have been from women who were pregnant, a group that wasn't expressly studied in the COVID-19 trials. Other workers turned it down because they already had the virus.
They actually don't need vaccine. We don't need to direct our vaccine to people that are theoretically already immune. And so our policy has actually been, along with what CDC recommends, that you can defer in those people for 90 days.
10 News surveyed healthcare providers in San Diego County and found the data is tricky. Some providers, like Sharp Healthcare, said they don't track the number of outright refusals. As of this week, Sharp said 75% of its health workers have been vaccinated. Scripps Health said it's vaccinated 67% of its workers so far, but it indicated some of the remaining staff may have gotten the shot from somewhere else. UCSD says only about 4% of its workers have refused the vaccine. Another 6% have delayed it for reasons like pregnancy. Experts think San Diego's overall refusal rate is around that, in the low single digits.
When you talk about, say, 5% or 2% declination rates, that's a 95 to 98% acceptance rate from the initial health professionals that were offered the vaccine. And we're the ones seeing these patients, and we know how bad this disease can be.
Ramers says anyone who's feeling reluctant about the vaccine should talk to their doctor. He says when you dig inside the data, just about any question can be addressed. Derek Stahl, ABC 10 News.